Hypocalcemia, understanding the causes, assessment, and nursing interventions. Welcome to NurseEdScholar. Today we'll discuss an important electrolyte imbalance, hypocalcemia, which is defined as a serum calcium level lower than 9.0 milligrams per deciliter. We'll cover the causes, clinical assessment findings, and essential nursing interventions to help manage patients with this condition. Let's dive in. Hypocalcemia can occur due to several reasons. The first significant cause is inhibition of calcium absorption from the gastrointestinal tract, which can result from inadequate calcium intake, lactose intolerance, malabsorption disorders like celiac sprue or Crohn's disease, insufficient vitamin D, and end-stage kidney disease. Another cause of hypocalcemia is increased calcium elimination, often due to conditions such as kidney disease in the polyuric phase, where urine output is increased. Additionally, diarrhea and gastrointestinal wound drainage can increase calcium loss. Hypocalcemia may also be due to a decrease in ionized calcium, which is the free calcium available in your blood. This can be caused by vitamin D deficiency, parathyroid gland issues including removal, kidney disease causing calcium loss in urine, severe pancreatitis, malabsorption issues, and low magnesium levels, which interfere with calcium function. Conditions like hyperproteinemia and alkalosis, where the body has too much base, raising pH, can also contribute to low ionized calcium levels. When assessing a patient with hypocalcemia, one key system to evaluate is the respiratory system. Hypocalcemia can cause respiratory failure due to muscle tetany, a condition involving painful involuntary muscle spasms. These spasms can reduce a patient's ability to breathe effectively. In the neuromuscular system, patients with hypocalcemia may exhibit anxiety, irritability, and twitching. They might also complain of muscle cramps or seizures. Hyperactive deep tendon reflexes are another sign to look out for. Additionally, patients may experience numbness in the lips, nose, ears, arms, and legs. They may also have a positive Trousseau's and Chvostek's sign, both classic signs of hypocalcemia. Assessing the cardiovascular system, you'll find patients may have decreased heart rate, hypotension, and diminished peripheral pulses. These signs are vital because they indicate how hypocalcemia affects the circulatory system. When assessing the renal system, urinary output may vary depending on the cause of hypocalcemia. In the gastrointestinal system, patients may report symptoms like hyperactive bowel sounds due to increased gastric motility, abdominal cramping, and diarrhea. It's important to monitor for EKG changes. Patients with hypocalcemia often show prolonged ST and QT intervals. These changes are critical to recognize because they can indicate severe complications related to electrolyte imbalance. Now let's discuss nursing interventions. First, check albumin levels. If calcium and albumin are low, the calcium level should be corrected. You'll administer calcium supplements either orally or intravenously, depending on physician orders. When giving IV calcium, warm the solution to body temperature and administer it slowly. Always monitor for EKG changes and signs of infiltration. You'll also administer medications that enhance calcium absorption such as aluminum hydroxide, which lowers phosphorus and increases calcium levels, and vitamin D supplements, aiding calcium absorption from the intestines. Throughout treatment, monitor for hypercalcemia as calcium levels may rise too high with supplementation. Implement seizure precautions, as hypocalcemia can lead to seizures. Move the patient carefully and monitor for signs of pathological fractures. This will help prevent injury during care. Lastly, educate your patient on calcium-rich foods like dairy products such as milk, cheese, and yogurt. Green leafy vegetables like broccoli, collards, kale, tofu, salmon, sardines, nuts, and dried beans. Dietary education is crucial for long-term management of hypocalcemia. To summarize, hypocalcemia can be caused by issues like poor calcium absorption, increased calcium elimination, or low ionized calcium. The assessment includes checking for neuromuscular symptoms, cardiovascular changes, and EKG alterations. As nurses, our interventions include administering calcium supplements, monitoring labs, and educating patients on diet and safety. Thank you for joining NurseEdScholar today. If you found this video helpful, Be sure to like and subscribe for more nursing content.